Trish Brownlee, please. Hi there, my name's Melissa. If you'd like to follow me, we'll take you through for your MRI scan.
Oh, good, thank you.
I work as a radiographer for the Perth Radiological Clinic. I specialise in the area of magnetic resonance imaging. So, Mrs. Brownlee, we're looking at your lower back today, is that correct?
Yeah, that's right.
What sort of trouble have you been having?
I've got a severe pain down my lower back on the left side.
You need to be very emotionally intuitive and supportive of patients who, in some instances, may be terminally ill and very nervous. So we ask you to remove all your garments except your underpants for these scans. If you can just put one of those clean blue gowns on over your head, then lock any valuables in the green lockers and we'll come for you in just a few minutes.
Okay, thank you.
Mrs. Brownlee, how are you going there?
Fine, thanks, I'm ready.
Okay, come on through and we'll do your scan. Just follow me.
Okay.
It's very important to check that all patients do not have any metal implants or devices in their body as they are entering a very strong magnetic field. Radiological technology is complicated, so procedures must be explained in language that patients understand. MR scans are obtained by the patient lying inside a giant magnet. Radio waves provide the contrast we need to visualise particular internal structures. Our doctors then examine these images to obtain a diagnosis. I never thought that I would have to rely so heavily on my computer skills. All the scanning and post-processing is all very computerised now. You okay there, Mrs. Brownlee?
Yeah, I'm fine.
Okay, lovely. Just going to get these scans started. Just a quick planning type picture coming up now. Just keep as steady as you can. Here we go. Mrs. Brownlee, can you hear me there?
Yes, I can.
Okay, now you've done pretty well on that first picture. There's just a little bit of blurring. I just need you to really make a big effort to not move at all. You must be really steady on these pictures, okay?
Okay.
Ensuring the list runs on time can be stressful because you feel the pressure to make up the time. No one likes to keep patients waiting. Okay, steady as you can, we'll get started with the next one. I hope she can keep still, otherwise my list will run late. As well as magnetic resonance imaging, there is also computerised tomography. This involves taking cross-sectional X-rays. Nuclear medicine involves scanning a patient following an injection of radioisotopes. Ultrasound uses sound waves to produce images. However, standard X-rays are still a commonly used method of diagnostic examination. Great, it looks like I've got all the sequences I need. Excuse me, Dr. Frequently we need to liaise with our radiologist to check that the examination was satisfactory. The radiologist is a doctor who has specialised in the interpretation of imaging.
Oh, it looks as though there's something very funny.
Dr. Ko is also a part owner of the practice. My role is as a technologist who deals with the patients and produces the images.
Excuse me, Melissa. I've got a patient who's feeling faint. Can you grab me a wheelchair? Sure.
I probably communicate the most with other radiographers. You are constantly having to keep each other informed of your actions. Here you go, Esther.
Thanks, Melissa.
Here, do you need a hand at all?
Yeah, that'd be great.
It's crucial to be a team player, even if a task is not within your job description. There are also daily tasks like coil changes, packing and processing films, and restocking that are essential to the general running of the practice.
Place your elbows onto the board there for me. Melissa, can you check my positioning for me?
Christy has just completed her 3-year degree in medical imaging technology and is now completing her 4th year of professional development. Like Christy, I did several years of standard X-ray training before I proceeded into MRI scanning. The base is here at the back. Make a straight. To be a good radiographer, you have to have a good grasp of maths and sciences. I enjoyed physics and anatomy at school, but communication skills are equally as important. I have undertaken additional studies since completing my degree. The industry is constantly evolving with new technology. This makes the job far more interesting. John Wright, please. I really enjoy the fact that I deal with all sorts of different people in the community. It gives you a very broad perspective of life. Radiographers play an essential role in helping sick and injured people.